Welcome back. Listen up. You see it everywhere, on the street, on the bus, in meetings. People bent over their cell phones or their iPads and tablets. We use them for so many purposes, and it may lead to a real pain in the neck. It's not just adults who are at risk. If your kids play games on handheld devices, they may be at risk for neck damage as well. Joining us now is Dr. Ray Solano. He is a chiropractor who says text neck is becoming a real problem. Thanks for coming in. Good to have you here.
Good to see you.
You know, I have noticed this. You have that kind of that hunched over appearance sometimes, and sometimes people are in that position for a long period of time. Is that what the problem is?
That is what the problem is, and that's what we're referring to. We're referring to as text neck, which simply put is forward head posture from prolonged usage of a mobile device. So that prolonged forward head posture with your chin down towards your chest is what brings a multitude of health concerns.
Even just, so demonstrate that for me again, because it doesn't seem like a big deal.
It doesn't seem like a big deal, but good posture keeps your ears over your shoulders. The second your ears go over your shoulders and the second you bring your chin just 1 inch forward off those shoulders is enough to put 10 pounds of pressure, not just on your neck, but on your shoulders.
You brought some x-rays with you so we can see what this looks like and what a normal, do we see what a normal neck position looks like?
Absolutely. That first image on the left, there is a side view of a patient's neck. They're looking to the left direction, and that green line illustrates a normal, nice curve in the neck. That's the way our body was designed. Now, if you look at the image on the right, that is text neck. There is a loss of curve, what we would consider a straightened neck, and you can also see in that x-ray decreased disc height, which is really what produces a lot of those neurological symptoms that patients can feel.
Tell me what the symptoms are and tell me what the potential health problems could be.
Sure. From mild to severe, we're talking about neck pain, we're talking about shoulder pain, we're even talking about tingling in the arm, disc degeneration, and even decreased lung capacity from that added pressure on the shoulders and chest from keeping that head and neck out in that forward head posture.
Decreased lung capacity?
30% decreased lung capacity if your head goes forward more than 2 inches off the shoulders.
Wow.
Imagine that.
And disc degeneration, you're talking about the discs in your neck?
We are talking about the discs in between those cervical spine vertebrae in the neck. So they thin out over a period of time, and as we're shown on that image on the right, over time, those discs thin out and irritate those nerves, and those nerves, Tony, travel to different parts of the upper body, so your shoulders, arms, and even your hands. So you can even generate things like weakness in the hands.
Okay, so tell me what we need to do to prevent these issues.
Sure. First and foremost, what we need to do is we need to bring our chins up. We need to keep our ears over our shoulders.
I'm sitting up as you say this. Yes.
And what we also need to do is we need to bring that mobile device up to us rather than us coming down to it. And also keeping your feet flat on the floor will help promote good posture throughout the rest of your body. And I think the cause of the problem really is taking breaks after 20 minutes of texting or sending messages, just putting that phone or handheld device down. And it's something we need to encourage kids to do.
Now, you say the cause of the problem, but what you mean is to help alleviate the problem, take a break.
Take a break, absolutely.
20 minutes max?
Limit it to 20 minutes and then maybe take a break for 15 to 20 minutes before you pick that up.
Are these issues, and you brought a number of devices here, and a couple of the devices are geared towards children, I believe. Same issues for kids?
Same issues for kids, although I think kids are more vulnerable. Reason being is when we were growing up, we didn't have these handheld devices. And also with kids, especially the younger children, their joints, their muscles haven't quite fully developed yet. So they become more vulnerable to these problems. I'm starting to see more and more of this every day in my practice, kids coming in with neck pain, shoulder pain, and we can tie it in most of the time to a handheld device. And I'm seeing 3, even 4-year-olds using these handheld devices.
Yeah. So what is the treatment? Once you've got the problem, what's the treatment?
Sure. Great question. The best thing you can do is consider hands-on therapy. The thing to remember is that text neck is a physical problem and it requires a physical cure. Prescription drugs is a Band-Aid on the problem. You want to consider things like chiropractic, physical therapy. I've even seen some yoga poses that are beneficial for these types of conditions.
Because over-the-counter or prescription medicine, that's really just for the pain, doesn't treat the issue that's going on.
Yeah, it's a temporary fix. You know, when the pain medicine wears off, you know, guess what? Your problem's still there.
Man, something that I know a lot of us have not thought about, but it is well worth thinking about, obviously. Ray Solano, chiropractor here in the district, correct?
Yeah, in Northern Virginia, Falls Church.
Okay, very good. Thank you for coming in, sir.
Thanks
We
for
do
having me.
appreciate it. Allison, back to you.
Okay.